Alright, let's talk about something a lot of people have heard of, but not everyone truly understands: palliative care. It's a term that gets mentioned in hospitals and clinics, but what does it really mean for patients and families? Don't worry, this isn't going to be scary or confusing. In fact, understanding palliative care can actually be empowering, because it's all about making life better, even in tough times. I'm here to break it down simply, so you can see how it might help you or someone you care about. So, imagine you or someone you love has a serious illness. It could be something that's been around for a while, or maybe it's a new diagnosis that's turned life upside down. Maybe it's cancer, heart disease, or something else that really affects day-to-day life. These illnesses can bring a lot of challenges, not just physical symptoms, but emotional and practical ones too. Now, most people think the only thing that matters is curing the illness, right? The focus is often on tests, treatments, and fighting the disease as hard as possible. But what if the focus shifted, at least part of the time, to making life better, no matter what the outcome? What if there was a way to feel more comfortable, more supported, and more in control? That's where palliative care steps in. It's a special kind of care designed for people facing serious illnesses, and it's all about you and your needs. Palliative care is all about improving quality of life. It's not just about treating the disease, it's about treating the whole person. It's medical care, yes, but it's much more than that. It's about comfort, dignity, and making sure you're heard. It's a team approach. Doctors, nurses, social workers who work together to help you feel as good as possible. They bring their expertise together to support you and your family, not just with medicine, but with understanding and compassion. They're not just treating the illness, they're treating you as a whole person. Your feelings, your worries, your hopes, they all matter. Think of it as extra support. It's like having a team in your corner, making sure you're not facing things alone. Palliative care teams help manage pain, shortness of breath, fatigue, nausea, and even stress or depression. They're experts at easing symptoms that can make life harder. They talk with you and your family about your goals, your wishes, and what matters most, so your care fits you, not just your diagnosis. They help you make choices that feel right for you, and they're there to answer questions every step of the way. Now, here's a myth I hear all the time. People think palliative care is only for people at the end of life. Some even confuse it with hospice care, but they're not the same. That's not true at all. Palliative care can be part of your treatment from the moment you're diagnosed with a serious illness, and it can continue for as long as you need it. You can start palliative care at any stage of a serious illness, even while you're still getting treatment to cure your disease. It works alongside your other doctors, not instead of them. It's about living as well as possible, for as long as possible. Whether you're at home, in the hospital, or somewhere in between, palliative care adapts to your needs. Let's put it this way. If you're dealing with a serious illness, you don't have to choose between fighting the disease and feeling better. You deserve both. Palliative care is there to help with both. It's about making sure you have the best possible quality of life, no matter what's happening with your health. It's about comfort, support, and making sure your voice is heard in your own care. Your choices, your values, and your story are at the center of everything. So next time you hear palliative care, remember, it's not about giving up. It's about getting the right kind of help at the right time, so you can focus on what matters most to you. It's about living fully, with the help you need, right when you need it. It's about making every day count, even when things are hard. And that, in my opinion, is something everyone deserves. No one should have to go through a serious illness without support, comfort, and understanding. Thanks for hanging out with me today. I hope you feel a little more confident about what palliative care can offer. Take care, and don't forget to look after yourself and those you love. Remember, asking for help is a sign of strength, not weakness.